Hi, everyone. Thank you for joining us today for the third in our series of grassroots advocacy training. This session is being recorded, and we will have it posted no later than tomorrow on the Foundation's advocacy page, the Advocate Resources. Phil and Dane are certainly no strangers to the Scleroderma Foundation. I'm going to briefly introduce Dane, who is with Health and Medicine Council of Washington. These are by far we couldn't have two better people walking us through this process. And I know that later in the presentation, Dane is going to introduce Phil. So thank you both for being here. One quick announcement, if you would, please, to minimize the background noise, if you haven't done so already, if you'll please mute your phone and your computer. If you have a question, certainly you'll want to unmute yourself. So, Dane, I'm going to turn it over to you. So it's all yours. Let me know when to advance the slide.
I will. Thank you, David. I hope I'm coming through clearly. Many of you may have accurately diagnosed me with a cold, so I'm only going to be doing half of the Phil Goglas in our office is going to do the other half of the discussion. For those of you who haven't met Phil, Phil came to the Health and Medicine Council a few years ago, and he had worked previously for Congressman Peter King from New York. Congressman King is the member of Congress that leads our Scleroderma bill in the House every Congress, so there couldn't be a better person to have helping the community manage the bill and try and get it over the goal line. For those of you who haven't met me, I work at the Health and Medicine Council with Phil. We help primarily nonprofit patient organizations make advancements on their policy issues. There's a common misconception, though, that lobbyists go to fundraisers and they do deals and stuff like that. But the reality is that's not even close to true. If we want to do something like advance research or improve patient care, the members don't want to hear from us. If Phil or I show up, they're not that interested in what we have to say, but they are very interested in hearing from you. So we operate as a grassroots network. We try to work together to make sure that we make progress on these issues and connect you with your members of Congress so that they know about scleroderma and that they're in a position where they can help on the issues. One of the things that we've heard in the past is that we do events like local visits in August or our Capitol Hill Advocacy Day, and people often feel like that's when they start to hear about advocacy. So we're working with Dee, David, and others to make sure that there's more of an ongoing conversation throughout the year, more updates on the process, and more information on how you can help. This will be similar in the beginning to the presentation that I gave in Arizona. I hope that doesn't mean everybody drops off. But of course, there's been a lot of change since then in healthcare reform with the tax bill and everything else. So we will give you a good update. But of course, the most important thing will be what's going to happen next with our scleroderma legislation. We're going to try to get through this in about 40 minutes and then leave plenty of time for questions at the end. So with that being said, David, next slide, please. All right, so this is a common question. Advocacy is a phrase that gets thrown around a lot these days. Folks are told to be their own advocate with their doctor. They're told to be their own advocate on healthcare issues. And in that regard, I should mention that what we're specifically talking about today is policy-related advocacy, particularly on the federal level, Congress, the government, engaging your elected representatives. We are not if neither Phil nor I is a certified insurance navigator nor a healthcare professional. So if you have a question that pertains to your personal insurance or something that happened with a benefit manager, we're not going to be able to answer that, nor should we. What we can talk about is things that are going on the high policy level, particularly federally, and what that, how that impacts your life, and also how you can influence the process. So really, if there's any recurring themes, one would be that you don't have to be an expert on this stuff to be effective. And the second thing would be that the system rewards those who take advantage of. These decisions are made by those who show up. Your lawmakers are in Congress. They're working on different issues. if you've never told them about scleroderma or the problems that you have or the community has, they have no way to help you out, and they might even do something that would be harmful. So what kids primarily do, since you don't have to be an expert on the process, you don't have to memorize Schoolhouse Rock or anything like that, they educate their lawmakers. And you might not even know who your 2 senators and your 1 representative are, but that's where Phil and I come in, and David, is we help you with those connections and identify the right folks and their staff. But primarily, the key step is education. And to know what scleroderma is, they want to know how.
I think Dane, your audio is a little not so clear.
The best way to do that is with your personal story. It's not about memorizing statistics or prevalence levels or things like that. If I continue to fade in and out, I hope folks will let me know, and I'll jump on the phone with Phil in the hopes that that might be better. But the key way and I'm going to slow down a little bit. I'm from
Dane, we lost you. Dane, there's no audio.
Dane's going to come over here, David.
Okay.
As I mentioned, computers are not my friend. My computer audio has decided it doesn't want to listen to me anymore. Sorry about that. So I am on the landline now, and I hope everyone can hear me much better. I'm not sure when I cut out, but I don't want to give a comprehensive rehash with just hitting the high points. The key thing that folks do is that they simply use their personal story to educate members of Congress about scleroderma, about how it affects them, about how it affects their family, about how they engage the healthcare system. It is not about memorizing a lot of data or scientific articles or explaining the disease process or explaining prevalence numbers. It's simply about your personal story and experience and anything anecdotally that's happened to you. You want to use your personal story to educate these folks. And at the same time, you want to make sure that you're making a local connection. You want to remind them that you're part of the community, where you send your kids to high school, the stores you shop at. This is their district. They represent you. You want to remind them that you're local and that you're part of the community that they're part of. They don't know if you voted for them. They don't know what your politics are. They do want to help you when you bring issues to them and try to educate them. Where, of course, if you just reached out to offices and said, I want to tell you about scleroderma, they would say, gee, thanks, but they wouldn't do anything. And if you reached out to them and said, hey, I need you to fund research, but you did it, tomorrow, they would say, gee, thanks, but, we're finishing the process now, so I wish you would have told us months ago. Where Phil and I can help is giving guidance on what Congress is doing and the specific actions that are needed at specific times and kind of how the process works. But the key thing is to start building relationships with your member of Congress and using your personal story to do that. Phil and I can help make those connections along with David and others. Next slide, please. So the next question would be, why do we advocate? If we know what it is, what's the point of doing this? I think as people know from the healthcare reform debate, the government touches nearly every part of our lives as it pertains to healthcare. They have everything to do with how you buy insurance, to how you see your doctor, to the things that you get prescribed, to the research that gets done. So since part of our grassroots mission, if you think of it as two sides of one coin, one side is advancing research, the other side is improving patient access to care and treatment, then the research side would be the National Institutes of Health. NIH is the foremost biomedical research organization in the world. They fund research into every disease. They, if you ever watch 60 Minutes or 2020, and you see a report about folks, researchers in Texas that have invented a prosthetic arm that can move with brainwaves, or researchers in Massachusetts that have a potential lead on an Alzheimer's cure, those folks are funded by NIH. The money does not stay in D.C. The money goes out to academic researchers across the country who compete for it on an annual basis. But if the foundation or the scleroderma community is raising money, it's usually to support young investigators or scientists that are just started in their career. Those scientists, by becoming scleroderma researchers, would then go on to compete for multi-million-dollar, multi-year research grants that are issued through the NIH. The better they get at knowing how everything works, the more likely they are to get funded. NIH currently has a modest but meaningful scleroderma research portfolio. I believe it's over $10 million annually, but it's been increasing in recent years. And that has to do with the fact that members of Congress who control the budget of NIH show an interest in this area and want to know what kind of research is going on. The Food and Drug Administration monitors and approves treatments that are being developed. The people think of industry doing drug development. Industry only comes in very late in the game. They commercialize the discoveries that NIH makes. So if you think of it as a process, NIH is first, then FDA is overseeing those therapies that might be coming to market, and then third in that process is the Center for Medicare and Medicaid Services, who oversees not only Medicare and Medicaid policy, but also the private insurance markets and how you get employer-provided or insurance on the exchanges. So, of course, these agencies work for your members of Congress. Your members of Congress work for you. The Congress also funds these agencies, and that relationship is what allows you to have an impact on what these agencies are working on, the types of policy decisions that are being made, because your member of Congress oversees them and funds them and wants to know what you think about them as somebody who actually benefits from the process. Next slide. So we did give a little bit of a primer on this. I'm going to try to make up some of the time that I took from you guys, but the key things, this is called a member-driven process, so the members decide, for example, what research NIH is doing, how lax FDA is being with treatment development and oversight. So your members prioritize this stuff based on who they hear from. The expression is you can be at the table or you can be on the menu. There's a downside to not advocating too. If NIH is deciding where to spend limited resources and nobody is expressing an interest in scleroderma and lots of people are expressing an interest in other stuff, you may see that the portfolio starts to contract. Those other areas start to grow. So Congress is very attuned to what the constituents think. The stuff we talk about is not a partisan or political issue. It's purely educational. These folks can't help us out. They can't make a right decision. If they don't know what that is, they don't know anything about the condition, and they've never been asked to help. So we're not pushing back against an opposing point of view. We're pushing back against the fact that as a rare disease, a lot of folks, including our legislators, probably don't know a whole lot about it. That being said, from that process standpoint, everybody who's within the United States has 2 senators and then 1 representative. So the 2 senators are in the Senate, the 1 representative is in the House of Representatives, and all those members are there solely for the purpose of helping you out. If you've done it before, you'll find that they kind of, I want to say roll out the red carpet, but they're very accommodating to you as a constituent to gain that input from you and figure out what issues you want them working on. So they do make an effort to know how they can serve you. And the reason it works is because you have these representatives. If you're from Michigan, for example, though, the Wisconsin delegation is not going to be so interested in what you have to say, which is why we all work together. By doing it as a grassroots network, we developed that patchwork across the United States that allows us to reach lots of members and make sure that there's a critical mass of folks who are all getting the same message from the community, and they can then work together in Congress to make a difference. Next slide, please. And the question would be, does any of this work? If people have done this before, they go in, they meet their congressperson's health legislative assistant, they have a good meeting. People say, we hear you, we'll help out. But this isn't, accounting. There's not a direct line from point A to point B. You can leave saying, boy, that was nice, but did any of that make a difference? And I think what we've seen is almost certainly yes. There's a couple of places where you can really see the outcomes that have come from the government. The first is the research portfolio that I mentioned at the National Institutes of Health. This has been building year over year for a number of years. There have been years when NIH has gotten no funding increase, but has still managed to dedicate more resources to the scleroderma portfolio. So that's because members of Congress are showing an interest in this, and they're doing so because their constituents are telling them it needs to be a priority. So This is just an example on the slide of some of those grants, but they continue to fund more and more research on an annual basis. Right now, we've built ourselves up to about $20 million in annual research funding, which is great because we're a rare disease. They may be spending $800 million on breast cancer because a lot of folks are telling them that that's important, but even Scleroderma, when we engage the process, has about $20 million in resources, and they continue to make nominal investments whenever they get the chance. They don't take money away from other conditions. They wouldn't say diabetes isn't as serious as Scleroderma, so give us some of your funding. The best way to get more money is to have good science and then to have more funding available. So a common theme will be increasing the NIH's budget. The proverbial high tide floats all boats, but a better way to think about it is in order for our slice of the pie to grow, it's easier if the pie overall just gets bigger. And then, of course, we've been working very closely with the NIAMS Coalition, which is the National Institute of Arthritis, Musculoskeletal, and Skin Diseases, to our specific institute at NIH to ensure that they have the scientific feedback from our community and also know from working with Robert and others what valuable research is and how they can move this forward. It's been a very positive relationship. Next slide, please. And that spills over to something that we'll talk about a lot called the DoD Peer-Reviewed Medical Research Program. Unlike NIH, which funds research into any condition meritoriously, they fund the best science, quote unquote, but they do all conditions. The DoD program is specifically only for conditions that come on a congressionally generated list that deems them eligible for study. So every year Congress gets together, decides what conditions are going to be on this 30-condition list to compete for a $300 million pot of money. It's got hepatitis B and C on there. It has other, diseases, but it has Scleroderma too, because we asked for it. Even though we're a small part of the Department of Defense, a small part of the DoD soldier community, they put Scleroderma on the list because members of Congress create the list, and their constituents told them, you should do this for us, and they respond appropriately. This has directly resulted in at least $10 million in funding since 2005. So if you say, has my outreach made a difference? Yes. You should feel somewhat responsible for that if you've ever contacted your senator and asked them to be supportive of the DoD Peer-Reviewed Medical Research Program. Next slide, please. So, you say, how can Congress help right now? They're finishing off appropriations, the spending bills for the current year. They're then going to do the spending bills for next year, starting in January, February. We have two pending asks for them right now as they're trying to finish funding for fiscal year 2018. We want them to add $2 billion to NIH's budget. This is the same thing every professional society and patient group is asking for. This would bring the funding up to $36.1 billion. So that $2 billion increase will then facilitate growth in the Scleroderma portfolio. But Congress has got to get this done. If we get in a level funding situation, they're not going to be able to fund more research. The other thing is that we need to continue to be on that eligible conditions list. We are on the list, but they're working to finalize those appropriations bills. We need them to enact that list and make us officially eligible for the DoD program again in FY18. Our scientists are waiting to send in applications. These are the two things that Congress can help with right now. Next slide, please. I'm going to turn things over to Phil here. He's going to give you a comprehensive Washington update, and then we will, hopefully with the last 10 minutes, open things up for questions. I thank you for being so patient, and here is my colleague, Phil Goglas.
Hi, everybody. Thanks, Dane. So as Dane mentioned before, I used to work for Congressman Peter King of New York, and I've been at HMCW for a few years now. So I'm going to jump now into the Washington update, let everybody know what's been going on here in D.C. and how it affects us. So first we'll talk about the efforts to repeal health reform. We'll talk about tax reform that's currently being debated, appropriations, and then we'll touch upon our Scleroderma bill that should be introduced this week. Next slide, please. So healthcare reform, it's no secret that healthcare reform was a major campaign promise over the past almost decade since it was signed into law. And as Dane mentioned, we're very nonpartisan in anything and everything that we do because the patients and the community are at our forefront. So throughout the entire healthcare debate, we've measured all proposals against 4 pillars that we'll touch on that are important to the community. So the House proposal, according to the CBO, which is the Congressional Budget Office, nonpartisan office, they estimated that 23 million people would lose coverage over the 10 years, that the Medicaid expansion that has happened in numerous states would be reversed, and then what would be detrimental to the community would be insurance companies would be allowed to deny patients comprehensive coverage to those with pre-existing conditions through essential health benefits. The Senate effort, they relied on health savings accounts. Their cornerstone of it was to have the bare bones plan that would not help the chronic community, payments through insurance for high-risk individuals. It would also reduce Medicaid. But the Senate effort failed after Senators McCain of Arizona, Murkowski of Alaska, and Susan Collins from Maine voted no. Next slide. So as I mentioned, the 4 pillars that we identified that are part of the Affordable Care Act and are critically important to the Scleroderma community are prohibiting pre-existing condition discrimination, making sure that we prohibit lifetime and annual caps on insurance benefits, allowing dependents to stay on their family coverage until they're 26, limiting out-of-pocket costs for patients. We use these 4 pillars, and every proposal that was discussed, whether it be in the House or the Senate this whole year, we've measured against these 4 pillars. If it was something that would not include these 4 pillars, we were against it because without including these 4 pillars, the patient community would be the one who would suffer. Next slide, please. So, again, before I jump into tax reform, I'll tie up on the health reform. So, as I mentioned, health reform stalled after the Senate voted down their package. After that, the House had to vote twice on their reform package. The first time they had to pull the vote from the floor because the Republicans didn't have enough votes for passage. And then a few months later, they voted again and passed it. But after the Senate failed to pass any reform, leaders of the House and Senate decided to move on from health reform, move on to tax reform. Now, it's not to say that sometime next year they won't revisit health reform, but for the time being, they have shifted their attention towards tax reform. Of course, anything with tax reform affects the patient community as well. They are looking at a comprehensive overhaul of the U.S. tax code and other campaign promises that were made. Both the Senate and House have passed tax reform bills. I'm sure everybody is aware of how contentious it has been, with both sides fighting each other over the transparency of it and what it actually does. What we've picked out that's important to the Scleroderma community is in the House bill, it eliminates the orphan drug tax credit, and it doesn't provide any new incentives to facilitate the development of therapies, which is what the orphan drug tax credit was used for, to facilitate the development of therapies for rare diseases such as Scleroderma. It also eliminated the deduction for medical expenses, which many people use to help offset high costs of their medical care. Now, in the Senate bill, they eliminated the individual mandate of the Affordable Care Act, which, again, the CBO estimated will result in 13 million Americans losing health coverage. They also estimated that individuals would face higher premiums in the next 10 years because of change to the individual mandate. Now, they also drastically restructured the orphan drug tax credit, make it less generous and applicable in a way that still reduces rare disease therapy development. So from the patient perspective as well, and in a very nonpartisan way, we analyzed the bill and we found provisions that are very detrimental to the Scleroderma community. We have activated on some of those to contact the senators and the representatives to say these parts of these bills are not beneficial to our community, and we hope that you remove them or vote against the bill. We're not, again, generally, we're not opposed to tax reform. I just want to stress that because I know in today's political environment, we don't want to be accused of being overly partisan on one way or the other. We're not against tax reform. We're not for tax reform. We don't have an opinion on the act of tax reform. We've just analyzed bills and the effects on the patient community. Currently, the Senate and House are working in conference with each other to conference the differences of the bill. The President has mentioned he wants to sign the bill before Christmas, which would be next Friday the 22nd. We have yet to see exactly any results from the conferees, but there should be some indication on what the next steps are by the end of this week, early next week. Next slide, please. So now some new emerging coverage and access issues. Therapy restrictions, HR 2027. These bills you'll hear about again. We'll be discussing them on Hill Day. Specialty insurance tiers, HR 2999, and the premium cost sharing assistance, HR 3976, which I believe the community is familiar with. It's Congressman Kramer's. Hold on, I got a question here. Okay, so the question is, are you putting pressure on reps that are possible no votes on tax reform? So thank you, Jeremy, for that question. What we're doing is we've issued an action alert that the foundation, I believe, has distributed, and it's reaching out to every member so that way everybody can hear from the community, whether they be a yes or a no vote. There still are a few undecideds. Susan Collins, as I mentioned before, voted against health reform and the proposal in the Senate. He did vote for tax reform in the Senate, but he did so on the condition there's a handshake agreement with Senator McConnell to include two health-related reforms to make sure that in order for her to vote yes on the final bill, and that's to make sure that, the market is stabilized and that there is money with the result of the repeal of the individual mandate. There is money that goes in to help those who will be without insurance.
Yeah, this is Dane. We'll probably hold the rest of the questions to the end, but I just want to reiterate that we have not been urging, and we're not pro-tax reform or anti-tax reform. The same way we're not pro-ACA or anti-ACA. We are, as a special interest group, analyze every piece of legislation for the impact it would have on our community specifically. Right now, in the tax reform package, the Senate has some bad provisions in the repeal of the individual mandate, and the House has some bad provisions in eliminating the chronic care tax credit, a credit that people claim when they pay for medical bills, and also eliminating the orphan drug tax credit, which would effectively end rare disease treatment development. If we don't want that stuff to move forward, we do not have to stop the entire bill. As Phil mentioned, Congress is currently going to conference. If they know that we don't like these three provisions specifically, they can remove them from whatever package ends up moving forward. So the question is not to vote no on the bill. The question is the answer is these three particular provisions are bad for the scleroderma community. By registering our objection against them, our hope is that they'll either the bill won't move forward or they can just simply remove them from the package that they negotiate in conference. So that gets a little bit into the weeds, but much like with the health care reform bill, we weren't necessarily opposed to Graham Cassidy or anything like that. We were simply saying, please protect the four pillars of patient protection and don't include these provisions like health care savings accounts that would really be devastating for people with chronic disease. They can make other changes to the healthcare system, but don't include these problematic provisions.
Thank you, Dane. I hope that answers your question, Jeremy. If it doesn't, we'll be able to expand a little more after the presentation. So we're going to move ahead to the next slide. The step therapy and the specialty insurance tiers legislations, that's something we'll continue to hear about. But I want to really focus on the National Commission on Scleroderma and Fibrotic Disease Act of 2017 that we've been working on for the community. Congressman Peter King from New York is the lead Republican on the bill, and Congressman Elliot Engel, who represents parts of the Bronx and the Lower Westchester County are leading the bill this year, and they plan, good news to share with everybody, they plan to introduce the bill on Wednesday morning, and currently they are working on initial co-sponsors, and they are already a handful of bipartisan co-sponsors for the bill. So to give everybody an idea of what the bill does, the bill at no cost to the federal government, which is important because everybody always asks what is the cost factor to things. This, at no additional cost, will establish a national commission on fibrotic diseases within the NIH. So in the National Institutes of Health, it would evaluate and make recommendations regarding the improvements to the coordination and advancement of NIH-supported research. As Dane mentioned, with NIH receiving around $36 billion, we hope in 2018, FY 2018, $36 billion, they appropriate that money to different institutes, whether it be the National Institute of Arthritis, Musculoskeletal, and Skin Disorders, IAMS. They have NHLBI, the National Heart, Lung, and Blood Institute, NIDDK, which is the National Institute of Diabetes, Digestive Disease, and Kidney Disorders. So there are many different institutes at NIH that receive funding. What this would do is it would pool resources from these different institutes who have an interest in fibrotic diseases, because while the Scleroderma portfolio is housed at NIAMS, the other fibrotic portfolios are at NHLBI, for example. And unfortunately, those two institutes currently don't work with each other. What this bill would do is bring everybody to the table, pool the resources, study the incidence, duration, and mortality rates of fibrotic diseases, and evaluate the resources for diagnosis, and try and bring everything together to develop a long-range plan for use and the organization of the resources to advance research on fibrotic diseases. So we see this as something that's important, make sure that the federal government is effectively using the resources that they have to make sure that research on scleroderma and fibrotic diseases continues to advance and doesn't get stalled in the bureaucracy. Next slide. As I mentioned, the bill is led by Congressman King and Congressman Engel. What's important about Congressman Engel is he's on the Energy and Commerce Committee. That committee is the oldest standing legislative committee. It's vested with the broadest jurisdiction of any committee you will hear. They are responsible for consumer protection, food and drug safety, public health and research, as well as a number of different issues. So they're one of the big important committees in the House, and it's important to have Congressman Engel leading that effort, because now we have somebody on the Committee of Jurisdiction who will be shepherding this bill forward. This bill builds upon our previous bill, H.R. 3666, which was the Scleroderma Fibrosis Research Enhancement Act of 2015. That bill in the last Congress had 51 bipartisan co-sponsors from states like New York, California, Michigan, Illinois, Missouri, Colorado, Florida, Massachusetts, Ohio, Pennsylvania, Arizona, D.C., Maine, Maryland, Minnesota, Mississippi, New Hampshire, South Carolina, Texas, and Vermont. So what we are going to be doing now is re-engaging with those 51 members. Some of them have are no longer in Congress, but we will be working to engage them. It's important that we have as many co-sponsors, because what that does, it increases the probability that the bill will get passed. If you have a member who introduces a bill and they're the only one on it, it's less likely that the bill will move anywhere. But when you have 50 members of Congress who have come together to say this legislation is important, it increases the likelihood that it will pass. Last year we had 51 co-sponsors. We would like this year to get our co-sponsorship to at least 75. Home run would be 100 to make sure that we get it on the radar of leadership, showing them that it's important that they take this act seriously and that we get a vote on it. And next slide, David. So what's next? Where do we go from here? A lot has happened this year, and the year's not over, and a lot will be happening between now and the Christmas holiday. So in terms of appropriations, Congress is currently running on a continuing resolution. The fiscal year for the government is supposed to start October 1st, but we are currently on our second continuing resolution. The first one was passed before the end of the fiscal year in September, and it was supposed to run until December 8th. But as a result of tax reform and some other political considerations, they have decided to extend the continuing resolution to December 22nd, give them more time to negotiate some of the spending levels. Unfortunately, a budget deal hasn't been reached, which is needed for them to move forward on any of the discretionary funding. We are again asking for at least $36 billion for NIH, as well as listing Scleroderma as a condition eligible for study through the peer-reviewed medical research program. None of these bills have been voted on yet, but what we believe will be happening will be a large omnibus where they roll all of these appropriation bills together. What we don't know, because of what's going on with tax reform, is if they will vote on this before December 22nd or if they will have another CR until the new year. Excuse me. But we will keep everybody updated as that moves along. In terms of our bill, as I mentioned earlier, Congressman King and Congressman Engel are introducing the bill this Wednesday, December 13th. That gives us a week and a half, excuse me, before Congress breaks to get some co-sponsors in the House. Senator Kirsten Gillibrand from New York is working on a Senate companion bill that will be introduced in the Senate in the early part of 2018. And our bill will be a big asking point for our Hill Day in April. And we will be continuing to educate members about Scleroderma and the importance of this bill through local connections and through our Hill Day to make sure that they ask them to co-sponsor legislation. Next slide, David. So, making your voice heard, as you've heard from Dana and as you heard from myself, your voice is the most important thing here. Dana and I could go in every office and speak with them about Scleroderma, but the ones who make the difference are you guys. If you have any additional advocacy questions or you would like to get involved in advocacy, feel free to email me. My email address is there, goglas@hmcw.org. And I encourage you to register and participate in Advocacy Day 2018 in April. It's going to be a Sunday where you talk to halls of Congress, meet with members as your representatives, their offices, their staff. You share your stories with them, you educate them, and you develop new champions for us. And we continue to grow the amount of people in Congress who are Scleroderma champions and are there for the community. And then we'd also like to mention the importance of this advocacy and attending is the reason why Congressman King and Congressman Engel are leading the Scleroderma bill is because of the work of the Tri-State chapter, who have been in constant contact with members from New York, New Jersey, and Connecticut, and have been very active. And through that advocacy and through them being active, they've developed these relationships with members and their staff. And that's why we were able to reach out to them with members of the Tri-State chapter who asked them to lead the bill this year, and they both agreed because of that. And next slide, David. With that, if anybody has any questions, David, I don't know how you want to line up the questions, but if anybody has any questions, Dane and I are happy to answer.
Yeah, I think we can just, if you want to take yourself off of mute and we just ask them just out loud. I think there's not enough people that it would be too much background.
Hi, everyone. This is P. Sapati from the Delaware Valley chapter. Dane and Phil, thank you so much for your wonderful presentation. I just posted out there, I'm just wondering, since Pennsylvania was mentioned in H.R. 3666 for last year, whether that was going to be resurrected for the upcoming Advocacy Day.
Yeah, so I mentioned, instead of listing all 51 members who co-sponsored, I listed the different cities where they're from. So we will be engaging with these folks again, reaching out to them and reminding them that they have been supportive of the community in the past. They've co-sponsored the bill. We hope that they will again co-sponsor the bill and again be a champion for the community. And it will be something where when we have Advocacy Day, hopefully we have folks in from Pennsylvania who will then be making those visits with those offices.
And this is Dane. I just want to say that Phil is the expert on all things House of Representatives, and particularly congressionally related, but I believe Pennsylvania has 24 members of Congress, good mix of Democrats and Republicans. Delaware, of course, not as many. But why not? There's no reason why they all couldn't end up being on a supporter of the legislation. So we can get, even in addition to personal advocacy, we know that chapters organize very well. There are folks in Michigan and Colorado that regularly take advantage of things like that. But certainly the chapter should feel like it has an ability to engage any member of Congress that is part of the congressional district solely by the fact that you represent folks. You can speak on behalf of the entire state.
If you have questions that come up later as you maybe go back through and review this, or they come to mind, don't hesitate to send them directly to Phil or Dane or to me. If it's a question that's of general, would be beneficial, across the board, I can be sure to reply an answer or provide an answer in a larger form through an email or otherwise, so that we're sharing as much information as we have available.
This is Dane. If folks are considering questions, I'll just mention a larger dynamic that's occurring right now that I think makes it particularly important to speak out. Rare disease treatment and management of rare disease is, it can be costly by virtue of the fact that, a company is developing a therapy that treats a limited number of folks. That brings different economic considerations to bear. So there's been a lot of talk lately about, those types of topics. There's also been a lot of talk about discriminatory coverage practices by different payers. We mentioned a number of bills. H.R. 3976, Kramer legislation, has to do with insurance companies rejecting payments from charities for people who need assistance paying their premiums or co-pays or travel. If somebody helps you pay your bill, increasingly those payments are being rejected, and they're saying you have to pay the bill yourself. No one can help you. That's a big change in how people access insurance, or even how commerce is done. But beyond that, there's legislation, as Phil alluded to, that has to do with step therapy, which says you got to fail on this cheap therapy first before you can use the more expensive therapy. And that should be a conversation that you and your doctor have. A benefit manager shouldn't be deciding what the best therapy is for you. And if you have a progressive condition, you might not have time to fail on other therapies. And the third bill was specialty insurance tiers, where medications are put into what's called a co-insurance tier or specialty tier, and then you have to pay a percentage of the overall cost out of pocket. So they say you owe 10% of this medication. If the medication costs $1,000, you owe $100. So it's meant to be a barrier, but a lot of this has been directed at folks with rare diseases, including now potentially eliminating or reining in the Orphan Drug Act, because folks wonder if these treatments are just going to be too expensive. Can we afford orphan drug development? And the question is twofold. One is that we can. If people who are medically managed appropriately tend to be less expensive than people who show up in the emergency room or need organ transplants or have other serious issues. The second part of that is the human toll, which people don't talk about a lot. We should, because it's the right thing to do. Folks and their families who are directly affected aren't talking about dollars and cents in terms of what the best way is to get their health care. They just want, if there's a treatment available and there's a way to improve your life, folks should have access to that. So there's been a lot of misinformation being spread about the rare disease community, not the scleroderma community specifically, but rare diseases in general. And I think it's important at this time to start reminding a lot of these members of Congress that when they debate things like drug pricing or insurance company practices, that it's not always a dollars and cents issue. The important thing to remember is, how does this affect the folks that are directly impacted? And if you're a rare disease in particular, they might not be hearing from an overwhelming number of people. So your outreach you could be the only scleroderma person in their district that reaches out to them to explain what your situation is. And it's probably very, very different from a kind of a baseline healthcare situation. So it's going to be important that they can make a special consideration on your request or know what those nuances are. And of course, if anyone has any additional questions, we're happy to entertain.
All right. Well, Dane and Phil, as always, thank you so much. Our next webinar, I don't have that right in front of me. Dee, do you have that information handy?
Hi, everyone. I believe Shelley's going to be talking about public speaking and letter writing. And that date, I have my calendar here.
I believe it's January 22nd. Same time, Same place.
Mm-hmm. Yep.
Yep, they're all listed on the Advocate Resources page on the website, which once we have this recording downloaded, we will post it on the Foundation's YouTube channel, and it'll be available on that page as well, along with the other ones. Phil and Dane, as always, thank you so much. It's a lot of information to take in, but you guys do such a great job of making it very accessible and easy to understand. So, and also being so readily available whenever we need you. So, thank you very much.
Thank you, David.
All right. Well, I'm going to end the recording.